Hi, this is Stephanie doing my Harris flush check off. What am I doing? Okay, I'm going to assess the patient for the need for the Harris flush. I'm going to verify the doctor's orders, introduce myself, identify the patient with two identifiers. I'm going to educate the patient on the procedure and make sure they understand. I'm going to gather my supplies, close the curtain for privacy. I'm going to assess the abdominal area and wash my hand and don some gloves. I'm going to raise the level of the bed that's comfortable for me. Raise the left bed rail, lower the right bed rail closest to me. Assist the patient in left lying Sims position with the right knee flexed. Cover the patient with a waterproof pad and exposing only the rectal area. For the Harris flush, I'm going to gather my bucket, identify the temperature of water, which the water should be warm. I'm going to use 100 to 200 milliliters of water. I'm going to prime the tubing of the flush, and I'm going to clamp it off. I'm going to have the flush at waist level, at hip level. I'm sorry, at hip level. I'm going to insert the tip into the rectum, upward towards the umbilicus. I'm going to use the bucket. I keep putting this bucket down. Use the bucket and raise the level of the bucket until all of the fluids are inserted into the rectum. Then we lower the bucket 12 inches below the rectum and let all the fluid return back into the bucket. Then we raise the bucket again, at least do this procedure at least for 20 minutes or 5 times. Raise the bucket till it ceases with gas bubbles. And once that happens, we lower the bucket again, and let all the fluid return back into the bucket. Then we clean up the patient. Clean up the patient. Raise the rails of the bed. Lower the bed in the lowest position. Lower the bed into the lowest position. Document how the patient tolerated the procedure, how they tolerated it, the solutions, the results, education that I gave the patient, and notified the doctor.